So I want to discuss this after watching the Charlie Sheen documentary on Netflix, where he talks about abusing testosterone in like the mid-2000s. Remember that whole Tiger Blood era and winning? He says that he was openly abusing testosterone, and his testosterone was like in the thousands upon thousands, like 4,000. So he partially blames this excessive testosterone as a cause of his really bizarre erratic behavior circa 2011. Hello, YouTube fam. It's your girl, Dr. Fenwa Milhouse, your favorite urologist, Dr. Down Below, co-founder, co-CEO of Down There Urology in Chicago. And today I'm talking about something I see very often, and it's the dark side of anabolic steroids and their impact on your health. Let's talk about anabolic steroid abuse. Anabolic steroid abuse is the non-medical use of synthetic derivatives of testosterone purposefully at supratherapeutic or supraphysiologic doses. That means super high doses well above normal limits, typically for the purpose of enhancing muscle mass, strength, athletic performance, or just feeling just more rough and tough. This is not the same as standard TRT or testosterone replacement therapy under medical guidance and monitoring with the intent to stay within physiologic doses, or physiologic range. Anabolic steroid abusers typically acquire these drugs from black market sources, including illicit dealers from other countries, or even online. These are not done with valid prescriptions and largely unmonitored. So these men are taking these medications and not monitoring their levels. And even if they happen to monitor their levels, they're not doing it under the guise of medical management. But what many don't realize is that these drugs can have serious, sometimes permanent effects on fertility, sexual function, and even your heart. So let's break it down. What happens when you misuse steroids, why it affects your health, and what the science really said. When we prescribe testosterone replacement for low T in men, typical doses are around 75 to 150 milligrams per week. But bodybuilders, athletes, and other individuals may abuse anabolic steroids in doses ranging from 500 to 2,000 milligrams per week, typically using multiple agents, and that's 10 times higher or more than medical doses. And well documented are the associated increased risks of the heart, liver, hormone, and psychiatric complications. First, do your balls actually shrink? Yes. Here's the basic biology. Your brain, specifically your hypothalamus and your pituitary gland, normally controls testosterone production in the testicles. When you flood your body with high doses of extra steroids, so this is anabolic steroids or testosterone that is coming from the outside, the brain detects too much testosterone, and it shuts down its signaling from the pituitary gland. This suppresses natural production of testosterone and sperm in the testicle. So both testosterone and sperm naturally produced in the testicle shut down. Clinical studies have consistently documented smaller testicle volume among current anabolic steroid abusers, significantly smaller in active users compared to non-users. This atrophy or shrinkage of the testicles can be reversible when the abuse is stopped. Within normal medical use of testosterone, testicle shrinkage is typically modest with standard replacement doses, more common in younger men, and is more reversible in medical therapy for testosterone replacement therapy. As mentioned, testicles stop producing their own testosterone and sperm when they see a lot of testosterone taken in from the outside. Normal production of sperm also ceases, leading to something called azoospermia, where there is no sperm in the semen, rendering the individual infertile. I talked about this previously in another video. This is common and happens in both normal medical use and certainly steroid abuse. Check out the show notes for the link to that video below. Most men will recover once they stop testosterone replacement therapy within 6 to 12 months, but some men may not recover at all, especially at high dosages and prolonged periods of testosterone. So if you're an anabolic steroid abuser, you're more likely to have difficulty recovering your sperm production even when you stop than if you're getting it medically treated doses. So at first you notice a strong energy and libido boost, but when super high levels of testosterone replacement are stopped, your body's own testosterone production is low and recovery of your own testosterone, what we call endogenous testosterone, may be delayed, inadequate, or worst case scenario, permanently affected, leading to issues with chronic low libido and potentially even erectile dysfunction. Again, especially after prolonged or repeated cycles of abuse or medical doses of testosterone replacement have a very low risk of permanent dysfunction after stopping. Let's talk about heart risks. With medical doses of testosterone replacement therapy and careful monitoring, data from the Traverse trial, a large multi-center, placebo-controlled, randomized trial in men at increased risk of heart problems that took testosterone replacement therapy. So these were men that are already at high risk. This Traverse trial did not show an increased risk of major heart problems like heart attack, stroke, or heart death. It was such good news that it actually altered the label. They took the black box warning label about heart disease and heart attack off of the testosterone. But men who abuse testosterone at supraphysiologic doses or super high doses have a much greater potential risk for heart problems. Data from observational studies consistently show that supraphysiologic levels of testosterone in men can lead to increases in blood pressure, changes in cholesterol, arrhythmias or abnormal heart rhythms, and arteriosclerosis or hardening of the artery. It's not just physical either. Steroid use can trigger severe mood swings, mania, depression, aggression, and anxiety. It is supraphysiologic, again, super high, aka roid rage. This is what Charlie Sheen describes in his documentary when he was abusing anabolic steroids in 2011. Dependence and withdrawal symptoms are common at this point, with up to 30% of illicit users developing a dependence on it, making it harder to stop. Now let's talk about the myth of safe cycling. One common misconception is that you can avoid side effects by cycling, taking steroids for a few weeks and then stopping. But research from the New England Journal of Medicine shows that suppression of natural testosterone can occur even after these short cycles, and repeated use increases the risk of long-term suppression. A lot of men do recover testosterone infertility after stopping anabolic steroid abuse, especially if they're younger and use steroids for a short time. We may need to use other medications like clomiphene or HCG to help restart natural testosterone and sperm production again. And patience is required because recovery can take months or years. For few men, that recovery never happens, unfortunately. So, thanks for watching. If you found this helpful, share it with someone who needs to hear the truth about steroids. And subscribe for more science-based discussions right here. Make sure you like this video. Make sure you comment. Make sure you subscribe. Make sure you join me every week for all things down there right here.